Hello everyone, this is Archita and welcome to Concepts. So in this video, I'm going to discuss about vitamin C. So in the previous video, we are done with vitamin A. So I hope that vitamin A is clear to you all. And if you have any queries, do let me know in the comment section. जब बात करेंगे विटामिन सी की, the most important is the biochemical role of vitamin C and the deficiency manifestation, which is more likely to be asked in Viva. So we will be focusing upon the biochemical role and deficiency manifestation of vitamin C. But before that, अगर आपको मेरे वीडियोस पसंद आते हो या किसी भी तरीके से मेरी वीडियोस आपको हेल्प करते हो, then please subscribe to my channel Concepts and yes, do share it with your family and friends and your colleagues. Okay. So moving ahead to vitamin C. Now, as I have told you that there are two types of vitamins based upon the solubility. There are lipid soluble and water soluble. So vitamin C is a water soluble vitamins. Within the water soluble vitamins, there are two vitamins, which is the vitamin C and vitamin B complex. And this vitamin C is more likely of getting affected by heat. So this is more likely of getting like destroyed by heat during cooking. And this is also known as ascorbic acid. जब बात करेंगे vitamin C की, so it is also known as ascorbic acid and it exists as two forms, which is the L and D forms. But L-ascorbic acid possesses the anti-ascorbic activity, but D-ascorbic acid do not have this property. Remember this, dear students, that L-ascorbic acid and D-hydroascorbic acid. L-ascorbic acid and D-hydroascorbic acid has anti-ascorbic activity. It has anti-ascorbic activity. But when you see the D-ascorbic acid, it does not possess this activity. Okay, so this activity is not for the D-ascorbic acid. So this was about the certain few points which you need to know about the ascorbic acid. Now, talking about the biochemical role and functions of vitamin C. So, one of the most important property of vitamin C is its antioxidant property, and therefore it is also termed as the scavenger of free radicals. It is also known as the scavenger of free radicals, and therefore it reduces the lipid peroxidation. So due to its antioxidant property, the vitamin C is found to reduce the lipid peroxidation. And it has a very significant role in preventing cancer too. So this is the property of vitamin C in its antioxidant. Is that it possesses an antioxidant property. So this is about the free radical detoxification and reduction of lipid peroxidation, and therefore it prevents cancer. The second is the hydroxylation of proline and lysine. So after hydroxylation, what it forms is it forms hydroxyproline and hydroxylysine after the hydroxylation. Now, why this hydroxy proline and lysine is important? This is important because you might have heard about the collagen. Collagen क्या होता है? Collagen is like a fibrous protein which is present in the connective tissues and ये क्या करता है? Tensile strength provide करता है. So ये जो hydroxyproline है या hydroxylysine है, it is essential for the formation of cross linking. जो भी कोलेजन में जो भी क्रॉस लिंकिंग का जो फॉर्मेशन होता है, इट इज ड्यू टू दिस हाइड्रोक्सीप्रोलिन एंड लाइसिन. देयरफॉर जो कोलेजन में जो भी क्रॉस लिंकिंग होती है, इट इज ड्यू टू दी हाइड्रोक्सीप्रोलिन एंड लाइसिन. So therefore, जो collagen, it provides the tensile strength and to the fibers. Now we here have the tryptophan metabolism. So tryptophan metabolism से 5-hydroxy tryptophan का formation होता है and which results in the formation of serotonin. So this is important for the formation of serotonin. Now we here have the other biochemical role of vitamin C. The fourth one is the iron metabolism. Very important. Iron metabolism के अंदर because ये जो vitamin C है, it enhances the absorption of iron. ये iron के absorption को promote करता है. And also we all know that कि जो iron का preferred absorption state है, it is the ferrous state. Iron is best absorbed at its ferrous state. So vitamin C promotes the conversion of iron from ferric to ferrous state. The fifth one is the is the hemoglobin metabolism. So in that case, it forms the reconversion of the methemoglobin to hemoglobin. So it promotes the conversion of methemoglobin to hemoglobin. The sixth is the folic acid metabolism. So folic acid in the presence of the enzyme folate reductase. In the presence of the enzyme folate reductase, it forms THF, tetrahydrofolic acid. It forms tetrahydrofolic folic acid. So this vitamin C, what it does is it promotes the conversion of folic acid to tetrahydrofolic acid, which results in the maturation of RBCs. So this vitamin C also helps in the maturation of RBCs. Now the seventh important biochemical role of vitamin C is the tyrosine metabolism. So what happens is it acts as a coenzyme for this vitamin C acts as a coenzyme. It acts as a coenzyme for 4-hydroxyphenyl pyruvate. 4-hydroxyphenyl pyruvate dioxygenase. Dioxygenase. So it acts as a coenzyme for 4-hydroxyphenyl pyruvate dioxygenase enzyme. Now, the next important role of vitamin C is steroid synthesis, and therefore, जो vitamin C का concentration it is more likely to be in adrenal cortex. Adrenal cortex के अंदर जो भी vitamin C की quantity it is found to be in a larger amount, and therefore it promotes the steroidogenesis, and also it helps in the synthesis of bile acids from cholesterol. Bile acids के synthesis को ये promote करता है from cholesterol. So this is the important role of vitamin C. Now we here have the ninth is the phagocytosis. So it promotes the phagocytic action of leukocytes. Phagocytic action of leukocytes, and therefore it results in the formation of antibodies. Now at the 10th, it reduces the risk of cataract, and at the 11th, it is also involved in the reversible oxidation reduction reaction. As I have told you about the ascorbic acid and the dehydro ascorbic acid, so this actually helps in the reversible oxidation and reduction reaction in many processes, and which involves a change between the interconversion between the ascorbic acid and the hydroascorbic acid. So these are the important biochemical role of vitamin C, which involves the antioxidant property, and then you have the hydroxylation for the cross-linking between the collagen, tryptophan metabolism for serotonin, and then we have the iron metabolism for iron absorption and conversion to ferrostate, and then hemoglobin metabolism for reconversion of methemoglobin to hemoglobin, and then it helps in the maturation of RBC. Also, it is involved in the genesis of the steroid hormones and bile acid formation from cholesterol, and phagocytic action of leukocytes, reduces the risk of cataract, and involved in the reversible reduction oxidation reaction. So this was about the biochemical role of vitamin C. Now further we will be moving ahead to the deficiency manifestations of vitamin C. So we all know that it involves scurvy. Scurvy is the deficiency manifestation of the vitamin C. So vitamin C की deficiency scurvy is more likely to occur, and the symptoms is irritability, fatigue, and any kind of joint pain, rough and scaly skin, and the loosened tooth. But if it occurs in infants, so infantile scurvy is also known as Barlow's disease. So it is also known as Barlow's disease. So infantile scurvy is known as Barlow's disease, which is more likely to occur at 6 to 12 months of age. So let me just highlight it for you. This is the Barlow's disease in the infantile scurvy. Now the second, which is more likely to occur, is the hemorrhagic tendency due to the deficiency of vitamin C. Just a second. Yes, hemorrhagic tendency of vitamin C. So in this, what happens is the collagen. We all know that collagen provides a tensile strength. But अगर vitamin C की deficiency हो जाएगी, in that case, the collagen will remain in an abnormal state and इसमें cross linking नहीं हो पाएगा. Due to this reason, जो capillaries हैं, it is more likely of getting fragile. So capillaries become fragile, and because of this, what happens is the tendency to bleed often increases under minor pressure. So the tendency to bleed often increases due to the vitamin C deficiency. Now, the third is the internal hemorrhage. Now, what is this internal hemorrhage? Internal hemorrhage is more likely to occur in the conjunctiva and or in the retina, and it is more likely to be occur in the form of epistaxis, hematuria, or melena. Now, at the fourth, we have the effect on the oral cavity. So very simple, the gums become very painful. It becomes very painful and swollen and spongy, and also you might know that vitamin C has a very to be known for wound healing too. So these are the deficiency manifestations of vitamin C. The first is the scurvy and the hemorrhagic tendency. Then internal hemorrhage is likely to occur, and then we have the within the oral cavity, there is the gums are painful, swollen, and spongy. Now, within the bones, what you actually see is that the bones becomes easily and the fifth we have in the bones. Now we will see what is the effect in the bones. So within the bones, what you see is that the osteoblast uh, is more likely to be converted into the osteoid. Okay, so during this deficiency, the osteoblasts cannot be converted into the osteoid, and therefore the bones become very weak, and and more likely of getting fractures, and therefore there is a painful joint case of painful joint, and also the vitamin C and vitamin B12. Vitamin C and vitamin B12 is an essential nutrients for in order to maintain the bone density. Now, one of the most important deficiency manifestation of due to vitamin C is anemia. Anemia may be is the microcytic and hypochromic anemia. Microcytic hypochromic anemia is more likely to occur due to the deficiency of vitamin C, एंड इसके जो रीजंस है इट कैन बी ड्यू टू द लॉस ऑफ ब्लड बाय हेमरेज, या आयरन का एब्जॉर्प्शन डिक्रीज हो सकता है, या टीएचएफ का रिडक्शन हो सकता है, या ड्यू टू द एक्यूमुलेशन ऑफ मेथहेमोग्लोबिन. Now these are the important deficiency manifestations. So total हमने 6 deficiency manifestations देख लिए हैं, जिसके अंदर हमने स्कर्वी, हेमरेजिक टेंडेंसी, ओरल कैविटी के बारे में देख लिया, एंड देन द बोन्स में जॉइंट पेनफुल जॉइंट्स हो सकते हैं, एंड अनीमिया में माइक्रोसिटिक हाइपोक्रोमिक अनीमिया is more likely to occur in severe vitamin C deficiency. Okay, so just let me highlight it for you. Okay, so now I talk about the dietary sources. Very common, हम सबको पता है that within the dietary sources citrus fruit है. These are more likely to contain the good quantity of vitamin C. Citrus fruits के अंदर such as orange हो गया, lemon, oranges, and Indian gooseberry. Indian gooseberry is or also known as amla. It is a very rich source of vitamin C. So if you want to include vitamin C in your diet, this is the preferred sources from where you can get the vitamin C. And guava is also again a very good source of vitamin C. And green leafy vegetables has many good effects, and it is very rich in other nutrients also. So green leafy vegetables should also be included in the diet of the patient deficit in vitamin C. So these are the dietary sources of vitamin C. And RDA की अगर बात करेंगे, which is the recommended daily allowances. So it is 75 milligram per day. And in case of pregnancy and lactation, pregnancy or lactation के case में, it is extended up to the 100 milligram per day. So this is the recommended daily allowance of the vitamin C. So vitamin C is very easy to understand and remember, but ऐसा नहीं कि vitamin C exams में नहीं पूछे जा सकते. In fact, in my own paper, vitamin C is asked in the university exam. So vitamin C is very important as per my knowledge. And so vitamin C के अंदर हमने देख लिया vitamin C की में L-ascorbic acid and D-hydroascorbic acid vitamin C activity को pauses करती है. And then we have seen the biochemical role of vitamin C and deficiency manifestation sources and RDA. So this much is more than sufficient for vitamin C. So I just hope that this topic is clear to you guys. And yes, किसी भी तरीके के suggestions है, do let me know in the comment section below, as it really helped me to create such contents. So thank you so much for watching this video. मिलते हैं next video में. Till then, keep studying and take care.